So you probably know how passionate I am about Botox because I think it's one of the most powerful agents out there for therapeutic healing of the skin in terms of pores, texture, tone, management of scar tissue, management of chronic pain, acute pain, postoperative pain, active acne. I've just recently finished 27 single-space pages for my website to update people understanding how powerful Botox is. But there are some limitations, and I always like to do the best thing for my patients in terms of therapy. So this video is about Botox for men. When is it applicable, when is it not, and who's it best for? So, and during this video, I'll talk about a few stories out there about when I have succeeded and when I have not succeeded as well with these therapies. So with women, unfortunately or fortunately, or however you want to look in our society, more youthful women are considered more attractive. When people say, well, I want to age gracefully, I want to look like Raquel Welch, well, obviously she's passed on. But the funny thing is, Raquel Welch didn't have wrinkles. She didn't have a saggy neck. She had a full face that was elegantly done. She looked really, really youthful. She looked like a 30-some-year-old person or a 40-some with absolutely no wrinkles and no sagging. So with women, our perception of beauty is intimately tied with fertility and youthfulness. Even if someone is 60 years old, if they look more youthful, we think they look more attractive. With men, it's a much more complicated psychosocial understanding of attractiveness. So I'll start with a couple interesting thoughts about this, which is that in third world, second world countries outside the United States, women were given different images of men to find who they thought was more attractive, and the same was done in America. What they found is that men in other countries were found more attractive if they were more masculine looking. Now, I don't necessarily mean that a feminine looking man is attractive in America, but less aggressive masculine features were more attractive in America than third world countries. Part of the speculation was that in second or third world countries, the very brute force aggressive male is the one that's going to protect the female from danger. Whereas in developed countries, more developed countries such as America, that very aggressive masculine face may be associated with men who cheat on you or that would run away from you. So there was that overly aggressive masculine face may not be as attractive as some Western countries. To add more complexity to female attraction to men is that they actually, I heard that a good number of women in the United States are on the pill, are on an oral contraceptive pill. And what they found is that women that are on a pill are not as attractive to men that are hypermasculine. So that could be a confounding variable as well. Why does all this matter? Well, it's about sexual attraction, and that's what Botox is partly about. But there are other reasons to do Botox, and I'm sort of going to clarify some of these concepts. At the same time, men that have some masculinity can be attractive. So what I'm trying to get at to begin with as an opening statement is that male sexuality is more complicated than for women. As men would look at women, and there's a sexual attractiveness toward a more youthful face, it's not so easy with men. So the first thing I talk about for men is what I call a bell curve, which means that men look better with a little bit of aging, and then they look worse. So what is that? Where does it look better? Usually in the 40s, sometimes 50s, sometimes 30s, but a lot of times women are more attractive to an older male because they are more dominant in terms of their paycheck, of where they are in their social standing. They actually did a study with women. They had the same guy dress up in a suit versus a fast food delivery outfit, and the guy that was dressed up in a suit was more sexually attractive to the female, even though he may have not been as attractive in his features. So there's a lot of societal bearing in terms of how we look at attractiveness. So women look at men with a little more attractiveness when they have a few lines. So with men, the goal is not necessarily eliminating wrinkles. What's interesting is that men have a lot more muscle, and so it's actually harder to get wrinkles completely removed compared to women. Women get a very quick return of investment in terms of reduction of wrinkles, but in a way it's almost socially built in that they don't necessarily need all the wrinkles reduced. Recently I had a gentleman, 30 years of age, had some moderate wrinkles, and the first question I asked him, and he wanted Botox. He actually came in initially for a hair transplant, which I told him he did not need one. But he asked me, can I do some Botox? I said, yes, I would probably do it once a year. After I first asked him a question, are you gay or straight? And I know that may sound offensive to some of you. It's not a judgment on whether you're homosexual or heterosexual. It's more, is it going to benefit you? So I really want to get a context to when Botox would be beneficial for a male. So he said he was heterosexual straight. He's 30 years old, and I told him, look, I could do Botox for you, but I would probably do it once a year or less often, because women do like a little bit of some wrinkles because it actually makes them feel more secure in an older gentleman, and I wouldn't knock it out. Now, when would I do Botox on a guy? So one is in a gay community, younger men are more attractive. Now, sometimes a younger male wants an older male because that older male has, again, more money, has more social standing, and may give them protection and security, sort of like a female-male relationship. But not always, right? Sometimes there's two females, there's together in a lesbian relationship or whatever it may be. But I'm just talking about psychosocial elements. I'm not trying to judge any of this. I'm just trying to help you look better for a good reason. So with men, if they are, so a little bit of aging is not necessarily a bad thing. Recently, if you saw my video this last week, I just Botoxed myself because my wife didn't like the results of my pores, so I did that treatment. She is younger than I am, and so that's the second category. Is if the male is with a younger partner, then the male doesn't want to look like the father, doesn't look like the uncle. I've had this where I work on a female who's actually not younger, they're about the same age, but the woman got so youthful looking that the male, I remember the story, the man was kept on being called uncle. And he says, look, I got to bring him in here. He's looking too old compared to me. And even though it's more attractive for a female to look younger, and she may actually not be chronologically younger, but I may have made her young enough that the male now doesn't pair well with her, and it looks weird and looks inappropriate if there's a much older male to female ratio. So that's a second reason why I work on them. So first reason would be if you're gay, if you want to look as youthful as possible, that's very true, or that you have a more feminine personality, you want to look more feminine in nature, you want to look younger, that's one reason. Second reason would be you might have a much younger partner that you want to be congruent with in terms of the way you appear. Or as I said, your partner may have just done a lot of Botox, look so much younger than you, or you're actually the same chronological age, you just don't want to look too much older than she does. That's another reason. Another reason could be that you're in a very competitive work environment where you think, hey, you know what? I need to look as youthful as these tech guys do so that I don't look, like grandpa here. It doesn't match, and that could be another reason there. I recently, about a year ago, had a CEO, and I did a few rounds on him, and I thought he looked too young. I said, to run a big company, I actually needed to pull back. I told him to take back some time to do less Botox so that he would look a little bit more to his age and appropriate. So I look a lot are you happily married? Are you with a much younger partner? Are you in the dating scene? Are you dating younger people than you are? Are you heterosexual? Are you gay? I hope you're not offended by these questions when I pose them to you. They're not meant to pry into your orientation or your lifestyle. I'm here to help you look better, because the last thing you want is for me to just randomly do Botox for you because you asked me, can I knock out my wrinkles? And if it makes you look worse, that's not good. And so the other thing is for heterosexual men that have wrinkles that say, look, I just want to look better. What's your endpoint, Dr. Lamb? So for my endpoint is I will give you I'll look at you, and even though I'm heterosexual, I know what looks attractive on men if they're trying to look heterosexual men. I think I have a standard of beauty for both men and women, so you don't have to be gay to appreciate male beauty. I don't have to be gay to say, hey, Brad Pitt looks good. But I do understand that when you look at male beauty going backwards, what I do is two things. One, I will tell them, as I did in that gentleman about the CEO, I'll say, you know what, I think you look too youthful. Let's pull back and give it some time. and look at an appropriate interval. The other thing that I do with men is I ask them, when did you think you looked the best? So some men tell me, you know what, I really thought I looked the best at 30. Great, okay, let's get you closer to that image of what you want for yourself. It doesn't matter what I want. I help guide you. But you may not want what I want, and you may want to look younger. Maybe it's not a younger partner. You just thought, hey, that was the best time of my life. I really looked my best at 30 or so, and that was the time that I want to look like that because that's when I look the best. Well, that's great. That's your personal decision. I'm not here to impose my values on you. I'm here to offer you an aesthetic evaluation so I can help guide you and give you some framework because you have a vacuum of framework. I want to give you the framework to have you understand how I can help you. So if let's say you're 55 years old, I'm 54, let's say you look the best at 42, minus, weight and diet and everything, but just in terms of wrinkles and how that looked. I said, look back to when you thought you looked the best and let's work hard to get there and then let's coast. So I don't want to overshoot it and make you look too perfect, then have to regress. So what I usually like to do is, because I told you with men, it's much harder to get the results there. So it's almost the opposite of women. If you think of women, they have a hard time losing weight at the gym, but they have an easy time in terms of reducing. Why is that? Because they don't have as strong a muscle. They have more tendency toward fat. It's the opposite problems here. Male testosterone, heavy muscles, make it hard for you to knock that muscle bulk down to start getting collagen regeneration. Whereas women, it's easier. But as I said, with men, it's not necessarily to knock out every wrinkle. So the goal is to sort of understand, how can I get to the point where you can coast? So I talk about my being a Botox personal trainer. And what that is, it means that the more I work you out, the more you can coast. So with men, the goal is to get it healed just enough that I can coast. The problem with men is exactly the opposite like with women. The more I can build you to get you where you want to be, I need to overshoot a little bit because you fail faster than women. So I need to get you just there so I can get you to a coastingville. And so these concepts of Botox for men hopefully are not offensive to you. If you are offended, I'm sorry. They're more meant as an education to guide you in understanding this. And you'll hear this. If you come into me as a prospective patient, obviously saves me a lot of time if you've heard this video and you go, I heard all that, saved me 10 minutes of telling me this. But if you haven't heard this video, I will tell you what I just told you to help figure out how I can best help you.